Hi, my name is Gaëlle Simard-Duplain and I'm an assistant professor in the Department of Economics at Carleton University. In my research, I study the determination of health and labor market outcomes. I'm particularly interested in the ways in which policy and family interact in shaping these outcomes. Recently, my work is focused in large part on intergenerational transmission mechanisms. That is, I examine how the circumstances in which people are born or grow up impact both their short and their longer-term outcomes, whether that's in terms of their health, their education, or their sources of income. We know there's a very well-documented correlation between the outcomes of parents and those of their children. What that means is that some people are at a disadvantage just because of the circumstances in which they're born. And even though we know about this relationship, there's still a lot of work that needs to be done to really understand and disentangle the various channels through which it comes to be. In line with this, I'm currently working on a number of projects in which my co-authors and I look at the intergenerational repercussions of different policies. For instance, we evaluate the impact of reducing access to income assistance on the employment and the health of mothers, on the health and educational attainment of their children, and on their children's own use of income assistance as adults. Our paper forms part of a much broader literature which serves to inform policy reflections about the social safety net, not only by providing estimates of impacts on the current generation, but also on the following generation. More and more, as researchers, we have access to incredibly rich data sets, which allow us to observe people when they're children, sometimes even before birth, and follow them over the course of their lifetime. Increasingly, this data also allows us to see how people interact with different service providers, for instance, the healthcare system or the education system. Of course, access to this data is an exceptional privilege, and there are a lot of measures in place to make sure that people's confidentiality is always protected. But this information is really important for research, especially research on the impacts of social or health policies, because the effects are rarely constrained to only one domain of people's life. For example, in an ongoing project, I look at the role that policy can play in improving access to services for children with autism spectrum disorder, and I investigate how this ultimately affects their health and their education outcomes. Because children with ASD often receive services from a broad range of providers, it's invaluable to have this multi-sector perspective on their experience. Otherwise, we only have a part of the story. And so my research has led me to work on questions which have direct policy relevance, and to do so with data that is both very challenging but also very interesting to work with.